So welcome to the Simulation Center. My name is Brian Hanlon, and I'm going to be introducing you to your patient today. So this is HAL. HAL is one of our patients here down in the Sim Center. So you'll notice that HAL has eyes that can blink. Eyes can be closed depending on his patient condition. So HAL's eyes are also reactive to light. So HAL has chest rise and fall. He can be breathing slow, he can be breathing fast, or in an emergency situation, not breathing at all. So HAL can also be intubated, as he has an anatomically correct airway. So if you are intubated correctly, you will see bilateral chest rise. So your patient today also has heart, lung, and bowel sounds that can be listened to. So an example might be wheezes. So your patient today also has pulses. So he has pulses on the carotid, on his radial, femoral, and pedipulses on his feet. So you can also administer IVs on our patients down here in the Sim Center. But we please ask you to not push any fluids of any kind. So in an emergency situation, you can also place IOs. Any medications to be administered will be provided for you by the Sim Center. If you are to administer medications, please name the drug and the dosage you were given. Alrighty, so let's go ahead and talk about our patient monitor. So your patient monitor will display patient's heart rate, your SpO2, respirations, blood pressure, and temperature. So all vital signs are continuous except for your blood pressure. So if you see a change in your patient's condition, go ahead and recycle that blood pressure. So to recycle your patient's blood pressure, go ahead and tap on the screen and hit stat. So we have functional head walls down here in the Sim Center. So we have oxygen, medical air, and suctioning. So if you are to administer oxygen, go ahead and turn that flow meter on. So any airway equipment will be provided for you by the Sim Center. So your patient will be speaking to you or not speaking to you, depending on his patient condition. So we also have our very own paging system down here in the Sim Center, so we can make announcements into the room. So our phone is a live hospital phone, so please follow the instructions on the sheet and only dial that number. When you dial that number, you'll be connected to our control room operator. They may then connect you to your doctor or whomever you are asking for. So remember, this is a safe learning environment, so feel free to ask questions, consult with your teammates, and have a little fun. So before we go, we please ask that you treat HAL as a real patient in the hospital, be respectful, and please do not poke our patient